Hello, everybody. My name is Sherry D. I am an almost 8-year valley fever survivor, and I wanted to come to you today as I am with my fungal breakout. And so I thought I would share with you how I treat these, where I think they come from, and basically I would call these lesions. They used to be nodes because they looked a lot like this. So once I get that round ball pus looking thing on my face, I sometimes it'll sit there and just sit there. And so what I do is I bring it to the surface. And so I'll push on it by trying to just push the fluid out of that little circle to see if that will work, to just erupt it back into the body and let it absorb that way. It doesn't always work that way. It usually doesn't, because if I've eaten the sugar, or it's usually sugar, dairy will do it, but dairy proteins break down into sugars, so largely that could be why that happens. On top of our body just doesn't know what to do with it, some of us with dairy issues. So what I do is I mess with that little thing. Like before, that one that I just showed you is about right here. And now I have this big one just came up and it's healing. These are healing, but I did want to show you how I do it while you can at least see what they look like while they're healing. This is the first one that popped up and it looked like a little circle. There might be a little one right next to it. Yeah, you can almost see there's like a little raised area. That's another one right there. Yep. So I push on it, and I usually try and hold it for about 20 seconds at least. And I will do cleansing breaths, just kind of to let the body release and relax. Hopefully the tissues will relax. And so that's what I try first. And then if that, sometimes that'll either bring it to the surface or it will go away if I completely stop eating any kind of blood sugar raising foods. But then what I do is I'll just I'll put my fingers on each side and I'll pull away from it. I don't pinch it and squeeze it. I pull away. So I put pressure and I pull away. So it's literally kind of like that is what I do. Okay, and then by putting pressure, it should make whatever's down below pop through. And interestingly enough, as you saw, that kind of looked yellow, and yellow is often a sign of fungal issue. Green is bacteria, so that's something to kind of a gauge. It's not always, but it's a good gauge to go by. Even though that looked yellow, and you would have thought that a pussy white would come out of that little picture that I showed you, that's not what comes out of these. What comes out of these and that is just a clear oil, if I'm lucky enough, if I catch it soon enough. Now, if I were to let it fester and just sit in there and feed it more sugar, yeah, then it could start turning yellow and really, getting ugly. So I kill it before it becomes a problem. So, it could be a node. Like sometimes I get them in my neck, I get them in my arms, I get them everywhere. So I kind of feel like when they're in the body, it's almost the same thing. It's just a pocket full of fluid, inflammation, right? And then if you throw some fungus in that fluid, and then if you throw, so then it's kind of cloudy, right? And then you throw sugar and you feed that fungus that's inside that fluid. Now it gets to get happy and populate, and now you've got even more pain and inflammation. So that's how I look at lesions, nodes, and nodules. So I think, to me, a nodule would be something that's inside the body that the body has encapsulated, and it's keeping it kind of safe. So it's a nodule. It's safe and it's in there. And then could be hard, could be just hard on the outside and fluid on the inside. I've had one on my thumb right here burst, and all of a sudden it got purple right here because the blood went and tried to attack it, and it took 3 days and it was gone, but it looked like a bruise. I'm going to go ahead and input that photo right here. This happened. The next photo, it just showed up that color within 3 hours. It did not hurt to push on it. It was definitely a fungal burst from my joint, and the blood went and attacked it. And I even treated it with Epsom salt, which I use Epsom salt and I use bentonite clay, which I will show you in a minute, but check out this thumb. And that was from dry brushing because I did some tutorials about dry brushing and it got that fluid moving. Bam! Kid you not. Check it out. Okay, so in addition to Epsom salt, so I'll just put a little bit of Epsom salt in a dish, and then I'll add some water, and then I get a Q-tip, and I make it a brine solution, and then I'll put it. I used to use it on my face, but I find it just a little bit too stringent, and ouch, it burns like the dickens. So I save, and plus I think I found bentonite clay. It's just more sensitive, more sensitive for our sensitive skin. So basically, this is bentonite clay. It might be backwards for you because I'm on a backwards screen, but it's a powder. And so what I do, like as soon as I broke the skin on that and went like that and oil started oozing out, what I'll do, I don't have a tissue here, but what I'll do is I'll get a paper towel or a tissue and I press on it. And then when I put the pressure, more oil comes out, right? And so we're getting that out because if I just let it sit there, who knows what's going to happen to it, right? So I push as much oil as I can out. I'm like, okay, I'm good with that. Push the paper towel. Okay, I'm good with that. And so I know that those pores are open, right? Because the stuff's been coming out. So I take a Q-tip and I wet it. I put water on it. Wait, first of all, whoop, back up. That is how I do spot treatments. But first, this is what I do. First, when it's really bad, is I get hydrogen peroxide, antifungal, right? And I squirt it on there, and be careful because this will bleach, you know, so you want to lean over your sink and it'll be like a little drip from there, and I'll let that drip just set right on the top, fizzy, 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 and then it gets all white, right? And then I let that air dry and the white will go away. Or sometimes if I'm in a hurry, I don't care. I'm in a hurry, I gotta dry this stuff up. Or if I'm going to bed, I'll especially do this treatment right here at night. So I wet the Q-tip and I just dip it in the powder. And then I take my hand and I do this. And then I go and I get some more water. And I make a paste with it. And then I take that paste and I apply it to the lesions. I try to make it as thick as possible, especially at night. It's not easy and it takes a while, you know, kind of got to get to know with it and kind of play with it. But there, and then it'll dry all white. It looks like I've been, you know, splattered with Cool Whip or something. But yeah, I just put this bentonite clay on all of them. All right. It's easy to find. It's on Amazon. This is Redmond bentonite clay, whichever. But so that is what I do with my lesions. I first break them open, make sure the pores are, or even just hot compress if you don't want to break it, because, you know, it is a risk when you break them open. You know, you run a risk for infection, but that's why I follow up with this. And I keep following up with this procedure until it's healed. I keep an eye on it. You know, and I don't go digging and poking, and when it does dry up, you'll find like little dead pieces of skin. They're annoying, and so I'll just take some clean tweezers. I clean my tweezers with peroxide before I use them on my face, and then I'll just grab the little skins and pull it off. And then moisturize. I love Hylunia.com HiMed. This is designed for cancer patients and radiation parents, burns, bed sores, severe dryness, fluconazole people. Yeah, it is called Reconstructive Cream. It comes in a set. You can buy it separate, but it comes in a set with some gentle cleanser, and it's the balm. That's what I use for my face. The cleanser and this is what I've been using on my face for 7 years now. And yeah, you know, I got a few wrinkles, but who knows? I'm pretty old. All right, but I'm happy, you know. It is what it is. So I hope you learned something. I hope that helps. That's how I deal with them. Some people have even gotten, you know, these sort of looking things other places on their bodies, and that's, I use Epsom salt, trace mineral salt, bentonite clay, hydrogen peroxide, and coconut oil. Okay, hope that helps. You're free to message me any questions at any time. Thanks.